Are we live? We are live. What's up, everybody? Let's see. I see Roel is in here. I'm over on Instagram. Molly, what's going on? Abgon, what's up? Great to see you. Thank you guys for hanging out tonight. We're going to get a few more people in here. Tom, what's up, man? Thank you for being here. You can see my settings a little different. I'm going to be live with Doc tonight. I'm at Performance Medicine Studios over here in Kingsport. Camera scenario, so I'm going to try to look as much at the camera as possible, but it's going to be a little difficult. Carter, what's up? Great to see you. Let's see. Connie Lynn, what's up? All right, a couple hours north of Kingsport. I'm assuming that's in Virginia. Tom? Ivy, what's up? Great to see you. I see Curse Color in here on Instagram. I see Taylor. What's going on? Thank you guys for hanging out. We got oh, sweet. Bluefield. I love Bluefield. Like I said, we got the camera up here and I got you guys down here. So I'm going to try to kind of, manage that a little bit. Hopefully Doc will look mostly at you guys, as we get going. There we go for the podcast people. We're getting live. We're getting going. We got 20 people in here. Frida, what's up? I'm in Kingsport also. Okay, so Roel, are you guys good? You guys doing okay? Down there in Texas, I know I've been paying attention to that, to the hurricane. I know that's, you can see, no, right here. That's Ike right here. A little different scene for us tonight, so it's going to be fun for everybody. Okay, good. Thank you, Roel. I hope everybody in Houston's okay. Do we have any Houston people in here? Any Houston folks? Anybody near Houston? Hey, Allison, what's going on? I know my my mom and grandmother are watching, probably on the road. They're probably listening. Wise, Virginia. Alana, what's up? Just wanted to make sure Ike wasn't eating something. Thank you guys for being with us tonight. There's Mama Bear. Mama Bear's over on Instagram. Mom, how we doing? We got this wide frame camera. See, Ike's right there. He's thinking something's up there, but he's not. But nothing's up there, man. Nothing's up there. All right, we're going to get to the show here shortly. If you guys got a question for Dr. Rogers, go ahead and put it in the comments. Before we get to that, I want to put this up. A lot of you were asking about this, mast cell activation syndrome. This is particularly fun for us here in East Tennessee, where the allergies can be kind of terrible. Here's what I would do with this one. We put in an article on MCAS adjacent to the podcast. I would follow the article as listening to, or while listening to Dr. Rogers talk about MCAS. It'll help you kind of follow along. There's a lot of big words, and I know you guys are better with big words than I am. I needed the cheat sheet to follow along, but I would encourage you guys to do that. And then my man, nutrition coach Lucas Schmidt, over in our Johnson City clinic, talked about cutting and bulking. I'm going to talk a little bit to Dad here tonight about cutting. I think he's in a place in life where he needs to cut a bit. I need to bulk. I need some bulk, I think. Stan, what's up? Bianca, what's up? Katie Lynn, you're right. I'll be honest. Katie Lynn, I'll tell you exactly what happened. And I hope Steve's in here because we just had pizza, and I had my Digest Shield, of course. I take 2 before pizza, and the pizza was sitting on that counter, and there's no pizza there now. But I'm assuming he was thinking maybe maybe there was still some left. Tom, I need to. I believe you can make that happen. Get a little bulking phase. But I hope you guys check those couple videos out. There's Izzy. Izzy Izzy, if you're coming on this early, they're not going to stick around for the show. All right, we're going to get to questions. If you guys got questions for Dr. Rogers, go ahead and put them in the comments. And I'm looking at Instagram too. So if you guys see Amy's in here, ADW, if you guys got questions for Doc, go ahead and put them in the comments over on Instagram. I know, Katie Lynn, he didn't get a thing. I think they put it over here. Okay, let's see if I got any other news. I'm going to put this up just because Roel's in here. And Roel recommended this book. We've been reading it over the last week or two, and Dad's been talking nonstop about it. And he actually wants to do a podcast on it. He gave it to me recently.
What have we been talking about?
The Align Method.
Oh yeah, that's a great book. It really has a whole lot of great stuff in it. It's not just spine; it's really good.
All right, so
It's a really good book.
I'm going to coach Dad. So Dad, we're going to look at that camera.
Okay.
And hopefully these dogs won't be too crazy.
What's a chilled out session?
You guys like the dogs around, right? We got Ryan in here on the 1s and 2s. Shout out to Ryan over there. Thank you for getting us set up here. Robin, I love that question around the VO2. Thank you. Courtney, love this question, especially around this time of year. Real quick, I'm going to do a little can you guys hear us okay with the dogs? Let us know. Can you guys hear us okay? And then we'll make adjustments if we need to. Of course, they'll probably make noise in the door upstairs. How you doing, man?
I'm doing good.
I am so glad that we get to do this in person.
Every once in a while, we need to do this.
I agree.
Over here together.
I agree. Carter said this is kind of our best format. Is when you and I are just kind of sitting here.
I enjoy it.
It's almost like we're father and son.
I know.
I know.
You're just a younger version.
Better
looking younger version.
Well,
plus
father,
you got your hair going. You almost have a mullet going on.
So don't see. This is what I get as the son being in person. I'm getting critiqued on. Ben, I probably need to shave. Need to shave.
I like the way you look. We need to get a picture up here of how you used to look when you played on the tennis circuit with your hair literally down to your low shoulder.
Yeah, it was.
I'll get a picture and show them next week.
We'll have to. Man, that'll be tough.
I won't show any more toes or feet. I'll just show a picture of hair.
Yes.
Okay. Yeah. He got on me for that.
All right. So, okay. So Katie Lynn saying y'all can hear us. Good. Okay. And Carter's liking the entertainment. Maybe that's see, they're playing. All right, let's get to some questions. Thank you, Loretta. I see you in there. Great question. Gigi Taylor, what's up? Megan Inspirations, so good to see you. Thank you for being here. Love this type 1 question. Thank you. Over on Instagram. All right, we're going to start with a couple of questions that came in throughout the week over email. Thank you guys so much for doing that. Gets our show start off on such a great note. I'm going to start with this one because it's pertinent to the last couple of weeks. Question is, I was watching Q&A recently, and your dad showed the new amino powder he's taking, Advanced Aminos. He's always referred to Perfect Aminos before, and we have been using that because of the protein. I've checked Advanced Aminos site, and it sounds similar, but was wondering why he switched it up. Also, does Advanced Aminos provide the same 30 milligram better utilized protein as Perfect Aminos?
I use them interchangeably. Really, they're the same thing, just different companies make them. The reason I get the Advanced Aminos really is because they're more available, a little more cost effective, I think. But they have the same amino acids. They both have 30 grams of protein. They're already broken down so you can digest them easily. So when I say Perfect Aminos, I really mean either that or Advanced Aminos. I think Perfect Aminos are harder to obtain. I think there must have been a shortage or something, but virtually they're interchangeable, in my opinion. So either one of them is just fantastic.
Now, say this listener is still using Perfect Aminos, are they easy to find or more difficult to find right now?
I'm not sure. I think they got a little bit more available than when
Okay.
I really started buying the advanced aminos. So that's what I've just kind of stuck with. And but yeah, either way, I think they're both great. Just get the best deal on whichever one you want.
All right. Thank you for that question around protein and perfect aminos. Love this question here. I'm 70, a female, and with the help of Robin Riddle, finally got my stomach problems cleared up. Huge shout out to Robin over in our West Knoxville office. I have an autoimmune disease, but still have so much inflammation all over my body. I am taking many supplements to help with this, exercise and eat right. I'm wondering if adding any anti-parasitic would help, such as Fenban or ivermectin. If so, how much and where might I purchase?
Yeah, it's not a bad idea to, number one, I'm glad you got your gut straightened out, because a lot of times it's a source of a lot of inflammation. And Robin's certainly the person to do that. I saw a patient today that she'd really, really helped on their gut issues. 2 patients today, as a matter of fact. But in any event, there may be some other stuff going on that's causing inflammation. It could be one of a lot of things. It certainly could be parasitic. I always think about Lyme. I think about mold. And if you look at the podcast from today on MCAS, mast cell activation syndrome, it could be you have that. It probably affects up to 18-20% of Americans. So look at that podcast. So a lot of times I try to break down that inflammatory cycle that you have using different methodologies. And, certainly it wouldn't be a bad idea to, sometimes I'll give a patient a month's worth of ivermectin, usually just a low dose at 15 milligrams, which you can get over the counter. And if you're in Tennessee at certain pharmacies, which is great. Only state in the country where you can do that.
Mm-hmm.
And I almost hate to say the I word anymore, but I'm afraid of getting kicked off. I don't really want to say the I word because I may get censored for using that for some reason. It's been used millions of times for many decades. But in any event, the other thing I do occasionally is if you have what I think maybe arthritis or an inflammatory arthritic condition, then I'll use a month of doxycycline. 100 milligrams a day for a month. And a lot of times if somebody has RA or, something that's unknown, a lot of stuff in medicine is still unknown.
Yep.
So I think a lot of these inflammatory conditions that we see really have an infectious etiology to it. It's just not known yet.
Yeah.
Kind of like when we didn't know about Lyme.
Yeah.
Rickettsial diseases or Babesia or some of those things. So an anti-parasitic medicine wouldn't hurt you. Dr. Salmon certainly uses a lot of them for a lot of different things. But I think that's perfectly reasonable to try it just to see. It's not going to hurt you. But the other things I do, if you do feel like you have MCAS, sometimes I'll use H1 and H2 blockers. Sometimes I'll use Singulair. Any way to kind of tampen down that over immune response, like we saw with COVID. That's what COVID caused, an acute inflammatory response.
Yeah.
And what they called a cytokine storm. And that was very similar to MCAS. As a matter of fact, we're seeing a lot of MCAS patients that were precipitated by COVID-19, and also probably reactivation of Epstein-Barr, maybe Lyme. But if you get to the root cause of the problem, you're always better off. So look at the podcast and consider some of those other things that I just mentioned. But certainly, if you want to go try some ivermectin, you can. Just take 15 milligrams a day for a month and see what happens. It
was super interesting around I keep saying MCAS, but it's MCAS.
Same thing, MCAS.
MCAS, and around some of the things you can do it, diagnosing it's kind of a problem. You mentioned in
there's no blood test for it.
Yeah.
So, but it's an interesting, very common condition, and a lot of people suffer for decades with this.
Yeah.
And those are the type of people that break out to everything. It seems like they're allergic to everything. And when they're truly not allergic, but it's just that their mast cells, which are your first line of defense against foreign invaders, that is hyperreactive.
Yeah.
And you got all this histamine along with other tryptases and chemokines and all kinds of inflammatory mediators that just get out of control. And actually, that's what happened with COVID-19. That's what happened. A lot of those receptors are located in the pulmonary vasculature. Most of them, though, originate from the gut. They mature in the pulmonary vasculature.
Yeah.
But so look at MCAS, try those things, and you're probably the type of person. You're the same age as I am, and you're unfortunately, our collagen's breaking down a little bit, and you have to do a lot of things to really help yourself. You need to take collagen.
Yeah.
You need to take. You're probably taking a lot of the things I would recommend supplement wise, and you need to see a functional medicine doctor.
Yeah.
I use a lot of rapamycin on patients. That's a prescription. You need to see a provider that does it. But, and there's another one I'm in the process of trying out that I'll have to talk about later.
Yeah.
It's actually an omega, but I'm going to do a podcast on that when I see how it works for me.
But, super interesting.
I'm going to keep that under wraps right now. But
out of curiosity, guys, have y'all seen anything work for yourself? Doc talked a lot about things that are working for him as he's aging with collagen, all these different strategies. So if you've had anything that's really worked well for you, put in the comments and let us know. So we always say, we get as much out of your comments as you guys get out of us talking up here. So put in there what's working for you, if anything is. Let's see. I see a bunch of you on Instagram. Thank you guys so much. Positive vibes. I'm going to get your question here shortly. Lisa, what's going on? So good to see you. I hope the whole family is wonderful. I believe y'all are in Sweetwater. Hope Sweetwater's doing wonderful. Y'all had a wonderful 4th. Rachel, what's up? Great to see you. Okay, let's get to our last question here before we go into the live questions. If you have a live question for Dr. Rogers, go ahead and put in the comments. This is a weight loss question. Question is, I am currently taking tirzepatide for weight loss. Would you add Gymnema also to help with the sugar cravings? We talked a little bit about Gymnema a few weeks ago.
Definitely works. And it especially works for sugar cravings. Tirzepatide works for a lot of different ways, but Gymnema really works more for on your taste buds. And it really, along with a lot of other things that it does, it kind of reminds me of berberine in a way, but berberine's more of a longer acting drug like metformin. But Gymnema actually works pretty quickly. That's why you have to take it like 3 times a day before meals. But it seems to really blunt that craving for sugar. Certainly you could take it together. Be careful though that you don't get hypoglycemic anytime, especially if you're diabetic or have a lot of insulin resistance. You got to be careful that you don't drop too low, but I combine them sometimes. Tirzepatide is not supposed to get you hypoglycemic, but certainly with other medicines, diabetic medications and supplements, it could. So be careful. That's why we always tell people check with your doctor before, for your own advice. But in any event, tirzepatide, it's interesting. Last night on the news, so it's kind of was big news. I watch the evening news every night, and they put a little teaser up there. The final studies are in on Ozempic versus Mounjaro, and the clear winner was Mounjaro.
Yeah.
By double, 8% weight loss on Ozempic, almost 16 on Mounjaro, which is tirzepatide. So basically, it was, to me, it's I hate to say this, but it's a clear winner. I've been telling people this for a long time. Yeah, it's just a better drug. I hate to say that thing. The Ozempic reps are on here because I love Ozempic too. It's a great drug, but when they added that GIP, less side effects, better weight loss. So it's a little bit more expensive, but we were having a meeting in office today, and a lot of it is kind of weighing out all the different things. You got to weigh in price to the equation, and for some people, semaglutide, Ozempic works really, really well. But based on what you're saying and that study, it's like the Mounjaro tirzepatide is just more effective. Yeah. And, again, just through experience of using it thousands of times, both of them, they're both great drugs. But I'll guarantee you, the Novo Nordisk people, they'll come out with something that's even better.
Yeah.
So, and they're supposed to have one that has 3 ingredients in it. That's probably going to beat all of them. So just stay tuned, and we keep up with all this stuff. So,
such a great question. Thank you for letting us talk about that topic there. We always, if you guys have any questions around the GLP-1s, if you're on them, want some strategies around it. I know berbering's been a popular topic recently. Go ahead and put it in the comments. Let's get started here, guys. We're going to go to live questions. Thank y'all for being with us this evening. Thank y'all for, I'm sure you're entertained by the dogs here. It's kind of a fun atmosphere.
Yeah.
We're active. I want to put this up just for fun, because I thought they were like this about an hour ago. So I was thinking that they were going to be kind of chill down here, and they're not.
It's a dog's life. They relax, but then they get hyped up. I know. I saw that. It's a great picture.
Jasmine, what's going on? Esty Bestie, how are you? If you're not following Esty Bestie Jazz on Instagram, you should do so. She's our esthetician in the West Knoxville office. Huge shout out to you. Let's see here. We're going to get to live questions. Where are we at? Instagram, I'm looking at you too. We're going to get to everyone there, so stick around. The only thing I can't put that on screen, I'm going to start with Robin here. I love this from Allison. Maybe Ike was looking for methylene blue on the table.
I hope he didn't get into it again.
All right, Robin. Robin, looking for recommendations for baseline tests for maximizing health. Would that be a VO2 max? Where and what other tests do you recommend? Body composition. So this is kind of a general one.
Great question.
I love this.
Certainly, I love the InBody. We have the InBody 570. It's a great a true analysis of your body composition that doesn't lie. I call it the truth teller. I like it because it does have the visceral fat measurement on it. So my recommendation would be to get an InBody 570 test. Takes 40 seconds. Our Knoxville and Johnson City office have the machines. And I do a Cleveland Heart panel, look at all your numbers and see where you are there. VO2 max is a great kind of overall measurement of fitness. And, I don't think the ones that on your Apple Watch don't work too well. There's a gym in Johnson City. I think TriStar is going to start doing.
Yep, it's at TriStar.
At TriStar is going to start doing a real one.
Yeah,
where they put the mask on you and you breathe out, and it's just a wonderful, a very accurate test on measuring your fitness. So I think if you can do that, I think it's a great measurement of probably how long you're going to live. It may be one of the best measurements. If you're looking for other crude measurements of fitness, there's some other stuff you can do, like just hang from a chin-up bar. See how long you can hang. See how long you can hold a plank.
Yeah.
See how many step-ups you can do. I mean, there's a lot of crude fitness tests, but for something like that, you need to probably work with somebody like a trainer that really knows what they're doing as far as what your VO2 max is. And I'm sure there's places in Knoxville that do it too, but certainly TriStar in Johnson City is a great place to do that.
Would you recommend doing something like this with the VO2 with, if you're looking at blood panels like a Cleveland in terms of just maximizing health, one, be your healthiest self, or would Cleveland be kind of like a different ball game?
Oh, it's different, but
okay.
You got to look at all the parameters. But certainly another thing we do besides the wall hang is the grip strength. I mean, your grip strength may be as accurate as anything for your longevity, assuming you don't have arthritis or hand problem, but it's pretty good. But yeah, I look at all those factors and kind of try to figure out heart rate variability is a very good measurement, which an Oura ring or a Whoop ring also will measure. Look at your sleep patterns. I'm charging my Oura up right now, so I don't have it on, but you have yours on. Great way to track your fitness. I like the continuous glucose monitors to see how if you've got any insulin resistance going on there. And so there's just a lot of stuff doing. The VO2 Max is just one of them. Dr. Attia loves it for sure.
It's awesome, Robin. Thank you so much for that. And sees the George Maxwell Jr. Thank you. That's awesome. Thank you for that comment. Thank you for that question. I love talking about stuff like that, things, especially since exercise is such a big component for healthy aging. Let's see here real quick. Do you think we're getting like attacked or something?
No, the dogs, they just bark a lot.
All right, let's keep going, guys. Thank y'all for hanging out. Let's go over to Instagram. Thank you guys for hanging out. Let's see. Mina, Amanda, what's going on? Great to see everybody. Positive vibes. Let me get to Megan's inspirations. Megan's inspirations. I can't put this on the screen, guys, but I will verbally read it. I will verbally read it. Hello. I was wondering if type 1 diabetics can benefit from berberine. Also, what are your top diet tips for type 1 diabetics? Thank you so much. Thank you so much, Megan's Inspirations. I'm looking for my brother's book around here. It's not around here.
Yeah. That's a great question. We're seeing more and more type 1 diabetes, which we used to call juvenile diabetes. Now we call it type 1 because it can occur later in life. We're seeing a lot more adults develop type 1. Of course, 2 of my 3 kids have type 1 since they were very young. But, you could take berberine with it. You certainly could. You probably should lower your insulin dose because it's going to bring it down a little bit. I like berberine with type 1s because you want to use as least amount of insulin as you can because, insulin is a fat storing hormone. It makes you hungry. It helps you store fat, which you don't want. So you want to use the lowest dose of insulin that you can to control your sugars. A lot of times doctors will just, eat what you want, just up your insulin. That's the wrong answer.
Yeah.
I've had endocrinologists tell my own kids that, which is absolutely insane thing to say, but because it's really time under the curve that's important. It's not really even your A1C. That's why you need a CGM. I'm sure you have one as a type 1 and probably an insulin pump, but which nowadays they communicate with each other and they kind of form a closed loop system where it's almost like an artificial pancreas. But certainly watch for hypoglycemia if you do. I mean, my daughter Kelly takes Ozempic with her insulin, and it's really helped her be on a way lower dose of insulin, and she stays lean, doesn't crave a lot of sugar, and knock on wood, I think she eats better than any of us.
Yeah, absolutely. Yeah,
she's very organic and very clean eater.
Yeah.
But in any event, I think it's fine. Just watch your sugars, and sometimes the combinations work really well. But eat the answer for diet: low carb.
Yeah.
Low carb, higher good fats, protein.
Megan's Inspirations, thank you so much for that question. Keep us posted with how you're doing. If you're seeing something that's working well for you, let us know, especially along the diet perspective. Okay, we're going to move back over to Facebook, and I'll get back to Positive Vibes on Instagram. Let's see where we're at over here. We're going to get to every single one tonight. Let's see. Let's go to Courtney on YouTube. How to deal with inflamed sinuses that cause me sinus migraines for years. Feel like I've tried everything. This is common, especially around here in Tennessee.
Yeah.
What's your thoughts on this for like sinus migraines?
Yeah, certainly a lot of things can kick off a migraine, including sinus. But I'm certain that you do something like a neti pot or the nasal irrigation with normal saline that helps inflame sinuses. I mean, I had a patient today that had to get sinus surgery to create windows so that her sinuses would drain, and it's worked perfectly for her. It's bad because if you have chronically inflamed sinuses, it turns you into a mouth breather.
Yeah,
it's a very unhealthy way to live from a lot of reasons. Certainly I like Flonase, the nasal steroid, the antihistamines, especially the H1 blockers like Zyrtec, Claritin, Allegra. But I think the nasal irrigation is probably the number one tip. I mean, some people that sinuses are infected and need it cultured. There's a lot of funguses up there too. Sometimes the compounding pharmacist will mix up a cocktail that has an antifungal as well as an antibiotic, and use a combination and a little steroid in them to kind of hit it with a broad stroke. But it's a chronic problem that should be able to be fixed.
Yeah.
You just need to get a good doctor. You may have to coordinate things with a functional medicine doctor and a ENT doctor to look at everything, but you don't want to go around like that because it just causes a lot of misery. Look at the MCAS podcast and see if anything's triggering that off. If you go to the beach and everything gets better, you need to move to the beach.
Yeah. Courtney, I hope that helps. Thank you so much for that. Okay, let's go to, I'm going to put this up from Connie Lynn. This is a win here. We love celebrating wins on the show. Berberine praised post-COVID A1C with Cleveland panel 6.1. 3 months later, 5.6. Incredible. So cool, Connie Lynn.
Berberine works. Berberine does work.
Yeah. Thank you for that. Let's go over to Instagram to Positive Vibes. Let's see. Okay, does IGF-1 LR3 interfere with fertility in men? Positive Vibes. Am I reading that right? IGF-1 LR3. Could that be wrong?
What is that question?
Right there. IGF-1 IR3 LR3 interfere with fertility in men?
I don't think IGF-1 insulin growth factor, which is a measurement of the amount of growth hormone you have. Not that I know. Robin Riddle could probably tell you more about that than I
could.
I'm not sure about
it's a peptide.
IR3. IGF-1 is a peptide. So is insulin. But
okay, it's a peptide. Okay.
Yeah, I don't use that other one. I use the IGF-1 sometimes, or an analog to it. The thing about peptides, they're hard to get now.
It says it increases prolactin a bit. So the question is around, like, would that
it could
you
gotta be careful with that.
Would interfere with fertility in men, you think?
It could if it interferes with the prolactin levels.
Okay.
Which can cause lowered testosterone. And lowered sperm count.
Okay.
So it could. The IGF-1 probably not.
Okay. Positive Vibes. Let me know if that helps. We'll have to. We can get back to that if we need more context to help.
Robin is our expert on that.
Yeah, she's incredible.
She probably could tell you about that.
We actually have a Positive Vibes. We did one Explain This with Robin Riddle on infertility in men in particular. This one had to do with the title's around hypothyroidism, but we talk a lot about just infertility in men in general. So check that out if you want to dive a bit deeper. Okay, let's keep moving here. If you guys got a question for Doc, go ahead and put it in the comments. We're moving along wonderfully. Loretta's asking, what do you recommend for anxiety and depression to avoid prescription medications?
Yeah.
I love this.
Again, nothing beats exercise.
Yep.
There's no medicine that will ever beat exercise for either one of those. And getting rid of what's causing your anxiety. I mean, what kind of stress you have.
Yeah.
Look at your hormones. My favorite supplement I have a lot of favorites, but I really like saffron.
Yep.
I like L-theanine. I like ashwagandha. As a matter of fact, that's in my stress formula. All three of them are in one pill. So that's a bestseller. People love the stress formula. So it's certainly all herbal. So it's not a prescription medicine. I agree with you. You want to, if you can, avoid prescription medications. The SSRIs like Prozac and Zoloft, in the long run, really, they don't work any better than placebo, to be honest with you. All the studies show that. Short term, maybe somewhat. And certainly if you do get on something like an anxiolytic medication, like a benzo or something, that's for short term use. Although I've had patients that just chronically nervous and they had to have them long term. But
yeah.
They're very habit forming and
yeah.
you can't just stop them. But so try to identify what's really bothering you and get out and exercise every day. Wear yourself out, get a good night's sleep, and try some of the herbals. They certainly help a lot. Have you ever taken the stress formula?
I have taken the stress formula, and I can tell you, I know a couple of people who, really swear by saffron in particular.
Yeah.
Like that one really,
I
helped
love
them.
saffron.
And I see this in the comments all the time when we, talk about it. People have seen, just amazing stuff with saffron.
CBD is pretty good too.
Yeah. Thank you so much for this, Loretta. I hope that helps a little bit. I love that you said exercise number one, though, because, getting into some sort of exercise routine is going to help.
I'm going to go ride my bike tonight.
I think you should.
Yeah, I'm definitely going to after I finish the podcast and jam a little bit on the guitar with Ryan, probably.
Yeah.
Get a few licks in, shred a little bit, and then go for a bike ride.
He goes
go to bed.
He goes straight from recording Q&A to
albums
putting down singles on the
sometimes
on Spotify.
whole
albums.
Yeah.
All right, let's keep moving, guys. I see positive vibes. I'm with definitely check out that the video with Robin Riddle around hypothyroidism with infertility in men. All right, let's keep moving. Let's see. Vicky on Facebook, 25-year-old female, normal monthly cycle since going on NuvaRing. Had several iron infusions over a couple of months, but ferritin keeps dropping to levels below 6 or 7. Scheduled another regimen of infusions, but need your help with what else I can do to prevent this from continually dragging me down. It affects my well-being dramatically. Let's see here. Okay, what's your thoughts on this? I know there's a lot of thoughts around NuvaRing.
You have low iron. You probably had heavy bleeding before you had the NuvaRing, or sometimes the growth control pills will help control that. But you've gotten anemic, which menstrual cycles are the most common cause for that in a 25-year-old female. And sometimes oral iron really takes months to really get your level back up. Certainly the infusions work way quicker. But there's a couple things you ought to try to look at. Look at your thyroid for sure. And the other thing I would look at is a zinc and a copper level. Sometimes if they're low, it's going to keep your ferritin level low. So that's something somebody may not be looking into, but look into your zinc and copper level. And remember, when you take iron, you got to take vitamin C with it or before you take the iron, because it helps the absorption a whole lot. For some people, ferritin is hard to tolerate on your gut, but that's a pretty low ferritin level. You probably have some other measurements like total iron binding capacity, iron saturation, things that need to be looked into. I'm sure you've seen a hematologist if you're getting the infusions, but certainly that's a quick way to get it back, but it may not solve the problem. So look at those other mineral levels, and certainly look at your thyroid and look at your total iron levels as well. Your ferritin is an iron storage number. So, the anemia thing can be complex. You can have low ferritin but not be anemic. So look at that, but please check your copper and your iron levels and see what's going on and do a more complete blood test.
Vicky, I hope that helps. Thank you so much for putting that in there, and keep us posted with how everything is going. Let's keep going to Roel here on YouTube. Doctor, I have a relative that's in his 60s, male, and has had heart issues in the past. Lately, he told me that the bottom of his tongue has been swelling up. Any idea what could be causing this? Okay, it's super interesting.
The bottom of his tongue. So I'm assuming you mean way back, the posterior part of the tongue. Or you may be talking about the underside of the tongue.
Yeah.
It'd be nice to know which it is, but take it from somebody who had major tongue problems a couple of years ago.
I remember. Yeah.
I mean, mine turned out to be lichen planus, which is a non-specified condition. It's really an autoimmune thing. And it was kicked off with me from my second little easy bout of COVID. It precipitated a little tongue problem. I mean, I had a rash and sores on my tongue, unlike canker sores. But I mean, you saw me. I mean, I couldn't eat hardly anything.
Yeah, I
Couldn't
remember.
drink water. That just killed me. Also got on the inside of my mouth. I actually had it biopsied. I was thinking, is this tongue cancer? That's the one thing you don't want to get. And it turned out it was lichen planus with an excessive inflammatory condition. And clotrimazole ointment's what helped me. But I also got on a carnivore diet, and I tried everything in the book.
I remember.
But I think it was the clotrimazole that finally, the ointment that really calmed it down, plus a carnivore diet. And eventually just kind of went away. I still get occasional flare up, but certainly have him look at a doctor to visualize this, because, if it's something that is a lesion that doesn't go away, if it goes away, it's not so worrisome. But if it stays and doesn't go away, then it needs to be biopsied. So, and if it's just swelling, goes up and down, it could be a reaction to food.
Mm-hmm.
I mean, he may have MCAS. I mean, he may have excess histamine release, from an underlying food sensitivity even.
Yeah.
So definitely needs to be on a probiotic for sure. Digest Shield, something like that.
Well, I hope that helps. Man, I know that's got to be difficult. Could affect everything really. You can't eat. Shoot, Roel. Thanks for putting that in there and asking for him. Let's get to Rob. What's going on, man? Got to hang out with you a little bit today. I loved it. So thank you for being here. Thank you for everything that you're doing with us. Rob is asking, got a question on using methylene blue in a cream form to treat chronic psoriasis symptoms.
Wow.
That's interesting.
Yeah, I don't know.
I have not heard of that.
So are you using that, are you saying, or are you asking if you can use it? Because I don't know. I don't know of a cream form. I guarantee the compounders could make it into a cream form, but I haven't seen it yet.
That's interesting.
Yeah.
Stain your skin, wouldn't it?
Yeah, seems like it would.
Rob, let us know if we need more context around that. Because one, that's super, super interesting. And let us know if we need more context. Okay, let's keep going here. I'll be looking for a comment, Rob, if you have some clarification. Let's go to Kristen. There we go. Do you test for bugs in the gut, or where can we go to get tested for that? And that's so funny, Kristen. Like we did, my brother Andy and Margot, who's in our North Knoxville office, do a ton of this, and it's super interesting. What's your
GI
thoughts?
map? Of course we do. Yeah.
Yeah.
You do a GI map, looks for all kinds of bugs, parasites, bacteria, candida, yeast. I mean, yeah, we do a lot of that.
Do you say candida or candida?
Candida, either one. I call it candida.
Candida?
Yeah, but it's really probably candida. Yeah, it's yeast. Okay, yeast is easier. But, he gets on me.
So, Kristen, GI map, and I know what was the parasite cleanse that Andy's doing? Cellcore detox.
Yeah,
but that's not a test.
Go in and talk to them.
Yeah,
and get the GI map, and then look at that, and then consider a detox. Depending, I mean, there could be a lot of bad bugs, like you say, in there. So,
thank you, Kristen. Let us know if that helps. Let's see where we are. D-Lynn is asking here. D-Lynn, thank you for being with us tonight. So good to see you. I watched a video today by Dr. Kathleen Ruddy. It was about ice cream killing cancer cells. Was wondering if Doc has heard anything about this.
Yeah, sure. Yeah. It's supposed to be effective. She's talking about the ice cream. The ice cream. Say, yeah.
The ice cream.
The one we used for that plague we had
a
couple years ago. But yeah, but I prefer Finbin, which is also anti-parasitic. We use it all the time, but ivermectin can work as well.
Yeah. Thank you, D-Lynn, for that question. Great comment there. Tanya over on Facebook, what are your thoughts on Ozempic increasing the risk of an eye stroke? I am on it and had an eye stroke in March. I'm 47 years old. Man, what's your thoughts on this?
Yeah, I read about that last night.
Really?
Very rare. Very rare. They called it some weird name I'd never heard of. But yeah, it can definitely cause it. It can interfere with the arteries and inflame your arteries in your retina. Now that's rare.
Yeah.
And, I think it was one of the ophthalmologists from Cornell or somewhere that was talking about it. But yeah, it can happen.
Yeah.
But rare as hen's teeth. And, you got to, with anything you take, you got to weigh the risk versus the benefits. But yeah, I'm aware of that.
Do you think for someone like Tanya, who's she had an eye stroke in March, should she pay more careful attention?
Yeah. I would make sure what exactly caused it and go ask your ophthalmologist and tell them hey, I'm thinking about Ozempic. So, and they'll probably tell you, well, the literature says it could happen. So
yeah.
So yeah, that's a great question. Funny that I just read about that last night.
Yeah.
In PubMed.
Tanya, thank you for putting this in there. And one, because, not many people probably know about that. And that's something that hadn't been talked a lot about. So thank you for that comment and that question. Let's go to Lynn K over on YouTube. Kidney infection. Will nitrofurantoin work for 7 days, 200 milligrams per day if caught early, or something stronger?
It's a great antibiotic for UTIs. It's another word from it. The brand name is Macrodantin. So yeah, that's one of the ones I use a lot of.
For kidney infections?
Mm-hmm.
Okay.
We also use it for prophylaxis for recurrent kidney infections. It's a pretty safe antibiotic. Rarely causes a pulmonary problem. I think that's rare as hen's teeth, but it's been reported, but usually very safe.
All right. Thank you for that question, Lynn K. Let's go to Karen on Facebook. Do you mind to tell the advantages of performance medicine vitamins? I love that. Besides being convenient to stop on and pick up, it makes sense. Your multivitamin just makes sense. Thank you. So what Karen's referring to is the Dr. Rogers formulas.
Yeah. And if you can order them over your phone, it's even better. Yeah. That's the trick. I'm not advanced enough to tell you how to do that, but I know you can order them on your phone.
Yeah, you can.
So, but anyway, yeah, I like them because I found myself taking too many vitamins. So I decided to combine a lot of the ingredients and make them strong enough to where I wanted the doses correct. After doing a lot of research on vitamins, 20 years ago, I would have told my patients not to take vitamins. Now, I think you're nuts if you don't. But and all the research supports that, really, even though you may see a negative report. Omega-3s may not work. They may cause heart disease. It's crazy. They're very safe. And I guess you could overdo anything, but, it's just you could find a study that says anything doesn't work. But use common sense and experience. But in any event, thanks for asking that. I don't put any fillers in there. I met these guys at one of our meetings in Nashville one time. I think that meeting in Florida. Orlando, I guess. But they have a company called Freedom to Formulate, and they're compounding pharmacists that are out in Portland, Oregon, and they put together vitamins according to what the doctor wants in them. So they don't use fillers. They still have a shelf life of 2 years.
Yeah.
So they're dated. They're tested 3 times. They're organic. They're sourced from either U.S. or Europe. They're not coming from China or India. And again, because a lot of the times, and using even a lot of vitamins that I've used in the past, you start looking at them, they're starting to put maltodextrin in them, cornstarch, some other stuff that you don't really need in there. You don't want in there.
Yeah.
So, and like my super, I put 5,000 of D with K in there, MK7, 180. I put 1,000 of the absorbable form of C. I do all the methylated B vitamins, vitamin A, the natural form of E, has selenium, zinc, copper, boron. It has everything in and that super pretty much covers a lot of things. So I like to make my own vitamins according to how much I want in there. A lot of times, if you pick up a Centrum or a Men's Health or some of those other vitamins, they just don't have enough in them.
Yeah,
Now, I can tell that because I check the levels. So for pureness, I trust them because they test them. They're all organic, and I think for your money, I combine them. You don't have to take that many different pills, so it's just a good bargain. It's what I want my patients, the kind of thing I take.
Yeah.
I just want to make it available. So
I think the one of the key things there is in the right amounts. When you look at lots of other multivitamins, for example, like they just don't have quite enough of the individual ingredients.
Can say they have all the stuff in it,
Yeah.
but you look at the milligrams.
Yeah.
It's not enough. So
Karen, thank you so much for that question and letting us kind of talk on the Dr. Rogers formulas. We'll have to we have to do a discount tonight on the shop. I know we've been talking a lot about vitamins tonight. We'll do something at the end of the show. Thank you, Karen, for teeing us up there. Lisa, thank you for sharing as always. It's so good to see you. Dr. Rogers, I'm feeling very tired and fatigued. I wake up this way, work all day this way, come home and go to bed early this way. Lost 123 pounds. I shouldn't be feeling this way. Any ideas? Lisa's lost a lot of weight quasi recently, and just hasn't been feeling great. And I know I don't believe, Lisa, you're eating a ton or maybe just not quite enough. What's your thoughts on this for Lisa?
Sometimes I see people that go through rapid weight loss have fatigue for months afterwards. I think it's your body's way of readjusting to a new metabolism. I'll definitely get a Cleveland panel and look at all your vitamin levels, your thyroid, your iron levels, the levels of your B vitamins, and get thoroughly checked out to see why you're so tired. I don't know if your other specific aches or pains or anything, but there could be something else going on that's causing you to feel this way. So get some blood work done. And as far as, anything that may help you feel more energized, because probably the most common reason people see the doctor, they're just tired.
Yeah.
Either they hurt or they're tired, but
try
some methylene blue if you hadn't. I love methylene blue for energy. It works really quickly, and I like it a lot. I like CoQ10, PQQ, taurine. That's my energy vitamin. I'm not trying to sell vitamins here, but I have combinations. Everybody knows CoQ10 is very great for energy, but PQQ, what CoQ10 does is it kind of stimulates your mitochondria to put out more ATP, the chemical source of all energy. But what PPQ does is stimulate your cells to produce more mitochondria. And then the taurine, which is the only good thing you'll find in a Red Bull, is actually very energizing as well. And it's also a great longevity supplement. So I do like the energy, but get some blood work to make sure nothing else is going on. You may have, the other thing I see is hair falling out for rapid weight loss. I don't know if you had COVID, you could have long COVID. I love LDN. So there's a lot of things you can do, but it really needs to be looked at with some a workup that would include blood work. But those are some things you can try as well.
Lisa, I hope that helps a little bit. Keep us posted with how you're feeling. Again, thank you so much for being with us tonight. Aletta here on YouTube about Zoloft, etc. What about Cymbalta? Is that a better choice short term than Lexapro or Zoloft? I know you have thoughts.
Yeah. The Zoloft, Lexapro, and Zoloft, Lexapro are the two. And if you put Paxil in there, that's another just pure SSRI. The Cymbalta is more of a combo, an SSNRI, what we call. It's funny because I was reading an article about which caused the most weight gain. And it turned out Cymbalta and Lexapro, Zoloft had the least amount of weight gain besides Wellbutrin, which is more of it's a different class of drug. than the other. It's not an SSRI. So, it just depends on what condition you have. Like I was saying a minute ago, Cymbalta, it's a very poor antidepressant, but sometimes it helps for chronic pain. It's more useful for that. So it's decent for chronic pain if you have to have it. It's not my first choice, but the others, Lexapro probably causes more weight gain than Zoloft. Zoloft seems to be a little milder. A low dose Zoloft, a lot of people will take. And again, these have been around for years. All of them have. Cymbalta is the newest one on the block, but so it's the better choice. Is hard to say. It depends on the condition. Again, I wish you didn't have to have any of them. Not to say they may not work, at least for a short period of time, but in the long run, all the studies are not real positive on them being much better than placebo, if any. But I've had a lot of people that have been on them through the years. Certainly, short term, sometimes it does alleviate anxiety and maybe a little depression. Again, placebo works 40% of the time for a lot of these things. So
yeah.
Again, that's something that you need to really talk to somebody that knows you, as far as a physician or somebody that can really kind of look at things a little bit for you.
I love that topic. Aletta, thank you so much for putting that in there. It's very common. And this sort of thing is, we don't talk enough about. I think people get put on, some of these medications for short-term use and end up staying on them for a long time. And so thank you so much for putting that in there. Okay, let's keep going here. I see Edna on Facebook. I'm still looking at you, Instagram. If you guys have a question, go ahead and put in the comments. How much vitamin B12 should a healthy 60-year-old woman take?
A milligram per day sublingual of methyl B12. You could certainly, if you wanted a shot for a little bit quicker action, you could certainly do that. I love B12. And I like the methylated form way better than the cyanocobalamin. But the other thing too, you don't want to just take B12, because if you take one B vitamin, you're likely to deplete your other B vitamins. So certainly if you're taking B12 either by shots or daily form, make sure you're getting all the B, like a B complex vitamin as well.
Yeah. Thank you, Edna, for that question. B12 is funny because, I think, is that the one that you can't really get too high? Is that, or can you get B12 too high? That your levels, you're just not concerned about.
I've heard about it getting too high, and there is a couple things you could be concerned about, but it'd be very hard to get it too high. It's water soluble, and I just really have a hard time believing you're going to have a problem with it in normal doses.
Thank you, Edna. Coal miner's daughter, thank you for being with us this evening. MCAS podcast episode was great today. I've been doing a deep dive on the subject for a couple of years. I've had lots of unexplained issues for years. They believe, they believe MCAS could be the culprit. So this is something that you've had experience with. So thank you so much for catching the episode. I hope it was helpful. Let us know if you have any more questions around it. Lynn K, what are your thoughts on protein powders? I like them, but so many powders and pre-made have bad stuff in them.
I agree with you.
Yeah.
I agree with you. I like them too. Certainly the Perfect Aminos, are great. I like them, but you probably want more protein as a supplement to get in there. But I like the pea protein. If it has to have a sweetener in it, I certainly like something like allulose or maybe monk fruit, maybe stevia. You got to be careful. Most of them have a lot of junk in them. You got to be really careful about it.
Anyone's the one I got you didn't love.
I loved it. Yeah, and we put it on here, but it did have sucralose in it. But it's such a small amount, it's probably not going to bother you. I'm not keen on sucralose, but I don't know why they didn't just put something like it. All the trouble they took to put the right pea protein and all this blueberry, all this great stuff. then they put sucralose in it. I mean, so you got to be careful.
Thank you for that question, Lynn K. I'm going to go to Instagram. I see a great question from Taylor. Taylor, thank you so much for being with us tonight. And I really want your answer on this. Question from Taylor is, how does a family med resident learn all of this information to provide the best care for their patients? Any resources? Great question. So family practice resident right now.
Yeah, that's going to be a toughie because they're not going to teach you, all this stuff about integrative medicine. You're going to be taught like a cookbook formula. You have so much stuff to learn. You're finally a doctor. You're getting experience under your belt. You're delivering babies. You're taking care of patients in unit. You're putting them on ventilators. You're doing all this different stuff. So it's a massive amount of stressful work situation, responsibility.
Yeah.
So, I mean, if they're interested in integrated medicine, which they should be in the long run, they're just going to have to do their own research. I would go to a forum like A4M, listen to Peter Attia, some of the people like that. Start doing your own research on hormones. They're not going to teach you anything. They're not going to mention hormones, and they're not going to do anything outside the box for sure.
Yeah.
So hopefully get through the residency, get a couple years of practice under your belt, and then do a fellowship in integrative medicine and get some experience. Experience is the best teacher, but it's just a learning curve. I mean, you're going to have to go through it, unfortunately. But I have met some that really did a pretty decent job of keeping up with things.
Well, I tell you what, thank you, Taylor. I'm thankful for that question because, I'm interested in kind of what you would do, knowing what you know now, how would you approach, residency, knowing that you do have to kind of, do the cookbook formulas. You got to kind of start with that base. Taylor, A4M, I'm sure you've heard of it. American Academy of Anti-Aging is what we're affiliated with and where we've had training and fellowships, and so kind of staying up to date with them. Taylor's not going to ask that question unless he's already listening to Peter Attia and
I love it.
Andrew Huberman, and
way ahead of the game.
I love it.
So
thank you.
They're thinking along the right lines. I can tell you that, and they'll be a very successful physician in the future. So just look at everything with a kind of the wisdom that you, and try to get into patients, really try to find the root cause of the problem. That's what functional medicine is about. And so listen to your patients.
Yeah.
So
thank you, Taylor. I'm going to see my sister's in here. Kelly, I love you. It was so good to see you.
Kelly's never been in here.
Does creatine make you bloat? And this is actually a great question. Creatine, does it make you bloat?
It causes a little bit of water retention.
Okay.
That's how it why people gain muscle with it, really, is because it brings a little bit of hydration to the muscle, which is good because muscle cells function better when they're well hydrated.
Yeah.
So you may gain a couple pounds with creatine, but it'll be muscle, be muscle weight. That's one reason we have our own creatine, and we put HMB in there, hydroxymethylbutyrate, which is a great substance for burning fat. So that's why I put that in there.
Yeah.
One reason, but it also helps build muscle. But yeah, I mean, but it's not a major gastric bloater, if you're asking that. I haven't found it to be.
And that is one, goes back to, don't take creatine unless you're also working out. You need to be exercising as well, right?
Well, anybody should exercise.
Yeah, that and protein as well if you're taking lots of protein.
Right.
Thank you, Kelly. I love you. Angie, it was so good to see you today. It was so much fun to be in the Kingsport office and get to see y'all. It's so amazing. So thank you for being here tonight. All right, we're going to thank you, Dave. We love you. How'd we do, guys? This was an in-person show. I get to hang out with my pops tonight. I'm so thankful. We're just grateful to be able to do this with you guys. And the dogs are coming down again. Thank you to all the Instagram people. We love you. We do this every single week, every Tuesday, 7 to 8. We answer your health and wellness questions. I'm going to put this up. Thank you, Aletta. I'm going to put this up here if I can find it. One is we're going to do wait about 10 minutes. I'm going to do a 10% discount on the store, performancemedicine.net/shop. And I'll put this up here for my mom. There you go. You can scan right there. The code will not work yet because I have not put it on there. But we're going to do a 10% discount for you guys tonight. It'll be for the next 24 to 48 hours. If any of these vitamins are interesting, check it out. Thank you guys. There we go. LiveQ10. LiveQ10 is the code. I got to remind myself of that because I gotta put that up. We do okay, guys? Carter, I love you. It was so good to be with you today. It was so amazing to get to hang out and get to work with y'all. Tom, thank you. Look at this. When are we gonna make that happen?
Good podcast. When he feels going to stop that nice new bar. Actually, somebody gave me a bottle of what was it? Oh, what's that bourbon? I'm blanking out on this.
Yeah, what was that?
Yeah.
Not McKenna's.
No, not Weller's, but actually not Eagle Rare. But I actually have some Pappy Van Winkle. That's what it is. I actually got a bottle of that. Somebody gave me
that.
Yeah, I do have some Pappy. So,
Tom, thank you.
Drinker, but yeah, that's funny.
Thank you. All right, we are gonna head out here, guys. We will see y'all next week. Thank y'all for being with us. Instagram, we appreciate you guys. Thank you. Thank you. All right, let's see. Thank you, Mama. Let's see where my outro's at. Where are we at? Ryan on the 1 and 2s. It's not 1 and 2s. It's 1s and 2s. Where are we at? See you guys next week, Tuesday, 7 to 8.
Don't go away.